due to your continued social distancing efforts, our data team has been reducing the R0 value since March 20th, which has greatly reduced the predicted number of infections and even better news, number of deaths. The model is set to a 4-day period, and we predicted a peak between April 17th and April 25th, likely to happen tomorrow on April 21st. Now that means we will not reach peak hospitalizations until from early to mid-May, due to the time between becoming infected and when symptoms would be severe enough to need to be hospitalized. And I know people are becoming anxious to return to a more normal life, but we have to remain vigilant in our social distancing efforts. We see it working, so we have to just keep doing it. We all have a role in this response, and right now the role of Tulsa County residents is to continue staying home and continue social distancing. Now, I have had a lot of people reach out to me and talk to me and telling me how they feel about this and where they're at through these past 4 or 5 weeks. And frankly, it's okay to not be okay. You never want to ignore or deny how you feel. And it's okay to go through a wide range of emotions and feel the stages of grief. I mean, I've talked to people who are feeling they're in denial, or they're angry, they're feeling sadness, and then trying to really deal with what's happened these past 4 or 5 weeks. And I think some people might even experience these full range of emotions during the course of a day. You know, there's no rule book on how to feel during the course of a global pandemic, and where the rules and social norms of our lives really has changed. You know, just 4 or 5 weeks ago, we were used to seeing our colleagues at the office and hugging our friends and going to church and taking your kids to school and eating out at restaurants and going to sporting events, rooting for your favorite team and doing all those normal things. And even things like petting your neighbor's dog, which you can't now. You're not used to seeing, of course, every day on the news, a daily ticker on the television screens that are counting the deaths of people around the world in your country, and seeing images of people in hospitals. And now that's become a daily occurrence. So, if you aren't okay, it's okay.
Our community, through great struggle and sacrifice by people throughout our metro area, has earned safety in this. There is, when you look at cities around the country and around the world, our death rate in Tulsa is significantly lower, and our hospitals are maintaining their capacity. That's what's allowing the governor to take the action this week that he is. And so I say all that, if one thing that I'm hearing from hospitals and physicians around town that is a concern is that there may be people in our community who, through great selflessness, are trying to keep that hospital capacity freed up for COVID-19 patients and aren't seeking medical attention when you need it. And so we certainly want to encourage people in Tulsa, if you feel like you're having a medical emergency, please don't try to tough it out at home. Seek medical attention. And if you need to go to the emergency room, please go to the emergency room. Thankfully, the work that most Tulsans are doing in social distancing has greatly reduced the number of patients that our hospitals are seeing across a broad range of infectious diseases, because people aren't spreading them. The same phenomenon that applies to COVID-19 is applying to a lot of other things. So please know that the hospitals have the ability, if you need to see a doctor or you need to go to the emergency room, they're there to serve you. Please don't hesitate to seek that medical attention. Secondly, we have really good news on the testing front. As I think everybody knows, we had some struggles in the early going, testing to really get a good feel for how widespread the virus was in our community. As Dr. Dart mentioned a moment ago, the Tulsa Health Department now has availability for anyone who has a single symptom of COVID-19 can now receive a test. All you have to do is call the Tulsa Health Department. Thanks to the state of Oklahoma, we now have 2 more locations locally at OU Tulsa, at 41st and Neal, and at OSU Health Sciences. Both of those locations now are available for you to receive a test if you have a single symptom. The other one that I'm very excited about is in partnership with Walmart at 81st and Lewis. Today, we have set up a free testing facility. If you are a healthcare provider or a first responder, you don't even need to have a symptom. You can go there and get a test for free. You just have to call or go online and sign up in advance. If you're not a first responder or a healthcare provider and you do have a symptom, you can also, this is now a fourth location in Tulsa that you can go to and free of charge get a test. And to access this, the vendor that's providing the testing is called True North, and they're doing this in partnership with Walmart. And you can go to www.doineedacovid19test.com, and we'll have that link on the city website immediately after this briefing for anybody that wants it. Or you can always call them at 1-800-635-8611. It is a self-administered nasal swab test, but they have medical professionals on hand to make sure that everyone's doing it the right way. Again, this site is supported by Walmart, True North, and both the state of Oklahoma and local officials at the city of Tulsa to test folks who have, if you have a single symptom, anybody can go. If you're a first responder or healthcare provider, you don't even need to have a symptom and you can go there. I'm incredibly grateful to Walmart for stepping up and supporting our community in this way and at this time and bringing this vendor to us. We're one of the first cities in the country that Walmart is doing this in partnership with. Lastly, I want to discuss, again, the road ahead that we're focused on. As I mentioned last week, there's really two main considerations. Heard Dr. Dart speaking earlier about when, and that will be guided by what our test results are showing in Tulsa. And as the White House issued in their guidance on Thursday, as you heard the governor talk about on Friday, as you've heard Dr. Dart talking about, we're looking for a data that shows that it is safe to begin rolling these back. And then we will do those in phases. Now, I'm mindful that as we do that, we want to make sure that we're doing so in a way that protects the safety of Tulsans, but also allows our economy to re-engage. And to do that, I've partnered up with the Tulsa Regional Chamber to establish the Mayor's Economic Recovery Advisory Committee. It's about 20 private sector leaders from across all sectors in our community that can provide me advice as we're considering those different options in partnership with the health department and with the state of Oklahoma and our neighboring cities, what we need to do to safely re-engage our economy here in Tulsa at the earliest moment that it is safe to do so.
Our new short-term vision is that the Tulsa region leads the nation in the recovery from the COVID-19 pandemic. Our new short-term mission is to be the engine driving the economic recovery of the Tulsa region, as Mayor Byrum described. And we've sort of established, if you will, three new external strategic pillars. Number one, to empower business. Number two, to advocate for relief. And number three, to convene and connect. The mayor referenced a number of directives that came down from Oklahoma City and Washington, D.C. last week. It was a week ago today that the United States Chamber of Commerce released an 11-page report entitled Implementing a National Return to Work. This document was delivered to the White House last Monday and then subsequently shared with chambers of commerce throughout the country. U.S. Chamber President Suzanne Clark appeared yesterday on Face the Nation to really discuss this report and to discuss how the U.S. Chamber was working with chambers and communities across the country. We had the opportunity last week on a couple of occasions to visit with Mayor Byrum and members of his team to talk about how the chamber could best assist him personally as well as his administration, in planning for a reopening of our local economy. We sincerely appreciate all that our local officials have done to ensure the safety of all of us. That, as Mayor Bynum described, is of utmost importance. But we quickly determined in meeting with the mayor that it made a great deal of sense for the chamber and the city to work together collectively for the good of all of us, to collaborate. And so consequently, we are delighted and honored to partner with the mayor and the city on the creation of this Mayor's Economic Recovery Advisory Committee. This is a very diverse 22-member committee consisting of veteran CEOs and business leaders from all walks of life. It has representation from banking, from retail, from energy, utilities, construction, manufacturing, salons, restaurants, hospitals, hotels, attractions, finance, aerospace, senior living, public health, education, nonprofits, and last but not least, the city council.